Dear student, today we will try to understand why parturition is achieved by a positive cycle. Parturition or childbirth, during this time, there will be activation of a positive feedback loop. We want to know how this positive feedback loop it is helping the process of childbirth. If we look into the stages of labor, the stages of labor can be divided into 3 stages. In the first stage, it will start with the onset of the true labor and it will end when the cervix is fully dilated. In case of primipara, it lasts around 12 to 16 hours. In case of multiparous women, it lasts around 6 to 8 hours. In the second stage, when the cervix is fully dilated, from the fully dilated cervix to the delivery of the fetus, this phase is known as the second stage. And after delivery, when the complete expulsion of the placenta, this is the third stage of the labor. Now, once the labor is started, so what happens when there is uterine contraction? That will cause the dilatation of the cervix. Now, this dilatation of the cervix is sending some signals through the afferent nerve to the central nervous system, which in turn increases the oxytocin secretion. So when there is onset of labor in the uterus, uterine contraction is there, cervical dilatation is there, it will send some signal through the afferent nerve to the hypothalamus. We know that in the hypothalamus we have the supraoptic and the paraventricular nucleus, from where actually this oxytocin is synthesized and they will be stored at the posterior pituitary, and this signal will enhance the release of oxytocin into the blood, and this oxytocin will be available in the uterus. Now, what is the function of oxytocin? Oxytocin will cause further contraction of the uterus and the labor pain is increased. So we can say that the onset of labor, contraction of uterus, then dilatation of the cervix, that will cause the secretion of the oxytocin, and this oxytocin will further increase the contraction of uterus. So it will happen in a positive feedback loop. So that we can say that the parturition it happens in a positive feedback loop. Now, one important point I want to highlight here: what is the mechanism of increasing contraction by the oxytocin? How oxytocin increases the uterine contraction? If we look into the molecular mechanism of the oxytocin, it will bind with its plasma membrane receptor, that is a G protein coupled receptors. So there will be intracellular increase in the phosphatidylinositol, IP3, DAG will be increased, and ultimately the calcium concentration will be increased. That calcium will combine with the calmodulin and the myosin light chain kinase will be activated, so the smooth muscle contraction of the uterus will be enhanced. Okay, now oxytocin increases the smooth muscle contraction of uterus by two ways. One is it directly acts on the smooth muscle and it make them to contract. Secondly, it stimulates the formation of prostaglandins in the decidua. Now this prostaglandin, it will further enhance the oxytocin induced contraction. So we can say that when there is onset of labor, the cervix is dilated, that will send a signal to hypothalamus. So more oxytocin will be synthesized and it will be released from the posterior pituitary. This oxytocin will further enhance the uterine contraction. So it will act in a positive loop. And how the oxytocin will enhance the contraction? Intracellularly, it will increase the calcium availability and it will directly make the myometrium to contract, and secondly it will enhance the level of prostaglandin and that will also increase the oxytocin induced contraction. So this is the reference. Thank you.